Oh man, okay. Aggressive spine adjustments, creative uses for chainsaws, and talk about a splitting headache. Today, we are breaking down the absolutely unhinged, heart-racing brutality of Doom Eternal. Let's dive right in. Look at the head get squished down. Like, where did the cervical spine just go? Our necks have all those vertebrae there that when you do have a compressive force, the vertebral body, the hard part that gives us the structure where the discs are in between, will actually compress down, explode, and actually have almost like a blowout fracture. And that's why things shorten. Oh, what the heck? Just split right in half. They did attempt to give us some good anatomy. You're seeing brainstem, you see a small brain. It does look different than ours, but you definitely are seeing different components of the brain. So good job on the creators. They could have just left it empty. You see two distinct lobes, almost like balanced motor function, and the other one's probably more for like higher level thinking. Oh, ow, ow, that hurts me right now. You actually see like good muscle definition in a game. Right at the joint, you're seeing a bicep, you're seeing pretty impressive like muscles of the forearm, but then you just see massive hyperextension at the elbow. If we're looking at this from a human anatomy standpoint, all that blood, you're thinking major artery that would be causing that much bleeding. Would it start spraying everywhere? Yeah, potentially. Depends on the person's blood pressure. You're squeezing and ripping somebody's head and neck off. Could you actually do that? Probably unlikely. I think of the old school movie Roadhouse where Patrick Swayze was able to take somebody's trachea out. We don't see these as common injuries in the emergency department. We do see traumatic head injuries, we see neck injuries, and everything in between, but very rarely do we see things that are totally like gone or off. Holy smokes, the amount of energy that takes smashing somebody's skull right in. So we're actually seeing brain tissue. You can see the gyre. We're seeing bone fragments. Again, common. This happens when somebody has traumatic injury to their skull, and people will come in and they say they're in cardiac arrest and we're doing our assessments. You can actually feel pieces of bone missing or step-offs. We have to be really careful not to cut our hands on somebody's actually newly fractured bones. Oh! This is more realistic in the sense of a chainsaw injury where it's taking a little bit of time to go through the body and being like stuck. Could you be throwing this much blood? Potentially. If it's just a single arm, bring the arm with you. You may not be able to reattach it, but if you don't bring the arm to the hospital, it's 100% guaranteed that you won't be able to reattach it. Whoa. Impaled with a chainsaw. Being impaled by any object, remember what I always say, don't take it out unless it's an absolute necessary reason to take it out, in the sense of you have to get somewhere, you have to put somebody in the car, it's too big, or it's a fixed object. There are always exceptions, but in general, if you can leave the object in place, that's what you should do. It's a smarter thing to do because you're not allowing it to be a hole where you're going to bleed out and potentially die. As you see the bone come through the skin, the medical term that we use when we have injuries like that is just an open fracture of the proximal humerus of the left arm. That's going to get infected because it popped through the skin. The skin has bacteria on it. And so an orthopedic surgeon needs to put it back in, clean out the wound, cleaned out the bone itself, and then using some hardware to reattach this to the shoulder itself. Oh, traumatic brain injury, and you see fragments going flying. So an impaled object through the brain, going through both hemispheres, unlikely a survivable injury. There's always exceptions to the rules. Again, you wouldn't pull out the object if you could. Stabilize it, get somebody to the hospital. This is an airway management problem, so you need to manage the airway, put a breathing tube in, get the individual to a neurosurgeon so they can evaluate what to do. Oh, interesting. Direct injury right to the chest, going potentially straight into the heart. You're breaking through the sternum, the ribs to that area. I've seen people who've done it to themselves, people who missed the heart and went right into the lung. If you don't hit the heart, you still have other structures that are quite dangerous that you can hit. If you're hitting your esophagus, your upper airway, and then both lungs, and then even just the spine on the back, depending on your angle. So a lot of important stuff is surrounded by the cage. Oh, come on. Come on. Guy's got a sweet haircut. Straight through the face, through the right eye, going straight through lower part of the brain, through the brainstem, midbrain, and out the posterior where you're hitting into the cerebellum, which is the balance center of the brain, as well as visual areas. Oh man, okay, bilateral lower extremity trauma, we've seen that, but posterior injury to the cervical spine going up. We see more like whiplash injuries and blunt trauma to the posterior aspect. This is straight through. We got organs flying out. What? Come on. Come on. Just the way the head got thrown back, that's whiplash. We see this in car accidents where people hit. Oh man, proximal, hard to tell if that is your ulna versus your radius, the bones of your forearm. The ulna makes up your elbow. The radius actually is the rotation component. They both snap pretty easily there. So this is an open fracture, probably dislocation. We're gonna stabilize you. We're gonna give you pain medication. We're gonna control the bleeding, and we're gonna try to get it back in anatomical alignment in place. What? This is cutting straight through the left upper vessels of your axilla, arm, branches off of the aorta, then straight through the lung, straight through the spine. This is a very strong chainsaw, but you know, not survivable injury, and you wouldn't even be able to put this back together. It's just grabbing somebody's eye, so puncturing through each globe, extremely painful. Could it be done? Yes, but then grabbing and destroying the skull. In general, could you do that? Unlikely. You can cause some fractures to the surrounding bones of the eyes, most likely, because some of them are really thin. But is survivable injury? Yes, unless you significantly cause massive amounts of trauma to the brain. Right damage straight into the eye. That looks very painful. I don't know if anybody's had a foreign body go in the eye. Even your own eyelash causes you to lose it, basically. So just thinking about the amount of trauma that's going on in somebody's eye like this. We see people who come in with scratches on their cornea, foreign bodies, extra contacts in there, and it causes a significant amount of pain and discomfort. Come on. Come on. Not like a normal human eye with the slit. It looks more like my cat's eye. You're seeing one thing attaching it to the rest of the body, which is probably the optic nerve. But for us as humans, we have the optic nerve in the back, which then has a blood vessel through it. But then you actually have 6 muscle attachments, so we can have all this crazy eye movement that we have. If we pull the eye out, it wouldn't do that. If you're playing Doom Eternal, you need serious focus and fast twitch brain power. That's where Level Up by my company, Life Happens, comes in. Check it out at lifehappens.com or Amazon. Oh, we end with a good one. We're seeing the lumbar spine exposed. Everything's kind of attached. You got some transverse processes there. You got the vertebral bodies. And we even have some appropriately shown intestines. Pieces of large intestine that they just get demolished and are gone. Doom Eternal is pretty intense, using a chainsaw for everything. But anatomically and from like a scientific standpoint, they're doing pretty good when it comes to the characters and what we're seeing, so hat off to them. And if you guys are interested in watching other videos that are similar or cool like this, definitely check out this playlist right here. Binge watch everything, and make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.